If you have painful peripheral neuropathy, there is hope for relieving your pain. There are a number of medications that are very useful in decreasing diabetic peripheral neuropathy pain. Some of them are new, some of them are very old drugs. One of the newer agents that's most widely used is a drug called gabapentin. And one of the benefits of gabapentin is that the dosage that we can use is very wide. We can treat patients with 300 milligrams a day, or we can titrate it up to 3,600 milligrams a day. So it's a unique drug that we can adjust the dosage for the particular patient to provide them relief. That's usually the first-line treatment for individuals with painful neuropathy. The side effects of gabapentin can be quite significant. The most common one is dizziness or lightheadedness. Also digestive symptoms such as nausea, not usually to the point where patients vomit, but to the point where they may not be able to eat normally. And certainly for individuals on insulin, that can be a significant problem. If gabapentin fails, the next step is actually a cousin drug called pregabalin or Lyrica, which there are many television ads for this drug right now talking about the treatment of fibromyalgia, but it's also been approved by the Food and Drug Administration for use in treating painful peripheral neuropathy. The advantages of gabapentin, number one, is it may take just 5 to 7 days to see some improvement in pain, whereas gabapentin may require up to 3 weeks to see pain relief or decrease in pain. Secondly, the side effect profile is much better. Patients have much less in the way of dizziness and nausea with pregabalin. One of the drawbacks to pregabalin, and I've noticed this particularly among women, is rather remarkable weight gain. I've had patients gain 30, 40, even 50 pounds on pregabalin for treatment of diabetic neuropathy. And obviously that's not good. That's going to cause your blood sugar control to worsen and will require your insulin requirement to go up if you're taking insulin. Another treatment option is actually a very old drug, Tegretol, which is a seizure medicine. Years ago was realized to provide pain relief in patients with painful neuropathy. And it's interesting to note that the dose we use to provide pain relief is a much lower dose than we use to control seizures. And it's a well-tolerated drug, with a fairly innocent side effect profile, especially in the doses that we use to treat neuropathy. Many patients with diabetes and with chronic pain have issues with depression, and there are several antidepressive medications which are effective in decreasing diabetic neuropathy pain. That includes an old drug, amitriptyline, also a cousin drug, nortriptyline, which are very effective in helping with depressive symptoms and relieving peripheral neuropathy pain. The dose for just treating neuropathy is a lower dose typically than is required to treat depression, so the side effect profile is quite innocent. And a new drug, Cymbalta or duloxetine, is a new agent initially approved for treating depression, which has also been approved by the Food and Drug Administration for treatment of painful diabetic peripheral neuropathy. There's also a topical agent which was kind of close to our hearts here in San Antonio. Capsaicin is a drug that was developed from jalapeno peppers. It's a very interesting drug. It's applied to the areas of the skin that are painful 3 times a day, and it works by depleting or releasing the painful nerve chemicals from the nerve endings and provide pain relief. The problems with capsaicin is that because of the way it works, patients may actually have a worsening of their pain the first few days on the therapy before they have pain control. And secondly, the drug needs to be applied with patients wearing gloves because it does cause a burning sensation in your hands if you don't wear gloves. And don't ever touch your eye, the corner of your mouth, once you've put capsaicin on a patient, because it'll create a very unpleasant burning sensation. As a rule of thumb, we don't use narcotics or opiate drugs in patients with painful peripheral neuropathy because this is a chronic condition. This is not a short-term painful syndrome, and no clinician likes committing a patient to long-term narcotic or opiate use. So in very rare situations do we use narcotic or pain medications.